All right, so we're looking at another aspect of respiratory distress syndrome, and this is towards its diagnosis. So diagnosis is more of like you're trying to confirm that a disease condition exists. That sometimes you are trying to guide your decision making on the type of drugs to use. That sometimes you're also trying to know the stage at which this disease condition actually exists. So diagnosis of respiratory distress syndrome, okay, is what we got here. So let's quickly look at it. So whether it's occurring in newborns or in adults, okay, you use a lot of things, you combine a lot of things to actually you use a lot of things to actually diagnose. Okay, so timing, onset within 1 week of non-clinical results. Okay, so you are looking at all those signs and symptoms. Okay, they have to also do imagings. So what you are seeing on imaging will also guide you, okay, to further confirm that the disease condition exists. So also, if you are seeing that there's fluid accumulation, okay, fluid accumulation also, you know, is one of the ways that will help you confirm. Okay, then you're also trying to look at the oxygen supply to the body. Is it still being maintained? So if it is mild, it's like this. If it is moderate, it's like this. If it is severe, it is less than 100 millimeter mercury. Okay, so this is basically for adults. Okay, this is basically for adults. How I can be able to confirm that respiratory distress syndrome exists in adults. So in newborns, there's grunting, nasal flarings, chest retractions, and of course, because the oxygen supply to tissues is not optimal, the body is kind of like becoming bluish. Okay, they're having difficulties with breathing. If you do a chest x-rays, you see a ground glass appearance. That's in newborns. Okay, the chest x-rays in adults, you see a bilateral infiltrate. Okay, the gestational age, you see that the baby was ultimately born before their time. So poor, okay, response to oxygen is poor. So even if you try to give oxygen from outside, response to it is usually poor. Okay, so supporting tests, you can do blood gases, pulse oximetry, echocardiography, okay, just to check out for that pulmonary edema, bronchospasms or sputum culture, just to identify if there's any infectious agents, okay, causing that issue. Okay, so that's what we have here for the diagnosis. That's various ways in which you can be able to diagnose respiratory distress syndrome.